Mr. President, I rise today to speak on a legislative proposal I unveiled yesterday with two of my colleagues, Senators Richard Burr and Tom Coburn, Dr. Coburn. This represents our vision for an alternative to Obamacare. Now, let me start by saying something that most Americans from Utah to North Carolina to Oklahoma know to be true. Obamacare just is not working. Try as he might during tomorrow night's State of the Union address, President Obama will not be able to convince the American people that his health care law is anything other than an unmitigated disaster. This horribly misguided law puts government between people and their doctors. It includes over $1 trillion in new taxes and a new unsustainable entitlement. It includes mandates and regulations that have forced too many Americans off their health plans and businesses to cut back on hiring. It has done next to nothing to put a brake on skyrocketing health care costs that are hitting every family in this country. Now, the three of us knew there was another way, a better way, a way that doesn't need 2,700 pages of government programs and mandates to enact common sense reforms that the American people want and need. And let me say, Mr. President, that these two senators that I've joined with on this proposal have been looking at this for some time, as have I. I commend them for their leadership. Our plan rests on four simple principles. First, repeal Obamacare with all its costly mandates, taxes, and regulations in its entirety. Second, reduce costs by taking the government out of the equation and instead empowering consumers to make choices about their own health care. Third, provide common sense consumer protections to protect individuals with pre-existing conditions. And finally, fourth, reform our broken Medicaid system by giving states more flexibility to provide the best coverage for their citizens. We're confident that our plan will accomplish all of this, Mr. President, and it would do so without adding one red cent to our $17 trillion debt. These four principles are the core of what we unveiled today. They are smart, they make sense, and they are what the people of my state have been looking for, and I think the people of every state. We start with the biggest barrier to health care in this country, and that happens to be skyrocketing health costs. Too many families cannot afford to buy insurance or to see a doctor. And why? Because of costs. We recognize this, and our plan would give people affordable options that really meet their needs by harnessing the power of the marketplace, not through Washington-directed mandates. With more options in the private insurance marketplace, particularly in small groups and individual markets, on top of greater consumer protections and more transparency, the American people would be better able to purchase coverage that is right for them. Mr. President, we can see the importance of choice in the failings of Obamacare, which is struggling to sign up young people who might just need a health plan that's affordable instead of one that includes coverage that they'll never use or need. Maybe a 25-year-old male auto mechanic, for example, just wants catastrophic coverage, and not a plan that includes maternity care. We give people those options to allow them to find coverage that best meet their needs. Our plan does that. We also include significant common sense consumer protections, like making sure that a person cannot have their coverage canceled if they get sick. We help make sure patients with pre-existing conditions can gain access to affordable coverage and let children stay on their parents' insurance through age 26, something we were always willing to do. We also get rid of lifetime limits. Under our plan, insurers won't be able to put a cap on total benefits to be paid out over a person's lifetime, eliminating a patient's fear of maxing out their health care coverage. And we give states more options to provide people with more coverage while once again reducing costs. Under our plan, families earning up to $71,000 or 300% of the federal poverty level will get a tax credit to purchase the insurance of their choosing. And we help small businesses enjoy the same advantages as large businesses by allowing them to band together to leverage their purchasing power to buy insurance. This just plain makes sense. Mr. President, I have to say one of the most absurd aspects of Obamacare is that a good portion of the people it covers is through Medicaid. Yet, as we all know, Medicaid is a financially unsound program that's threatening state budgets. Its expansion under Obamacare only threatens the program further. Our plan includes a key reform that's similar to the Medicaid modernization plan that House Energy and Commerce Committee Chairman Fred Upton and myself put out last year. Currently, federal taxpayers have an open-ended liability to match state Medicaid spending, which is a significant driver in Medicaid's budgetary challenges. Our proposal would create per capita spending caps, similar to what President Clinton and many Democrats who remain in this chamber supported in the past, to ensure that the dollars follow the patient. This structural reform of Medicaid is coupled with new flexibility for states to best manage their Medicaid populations. On top of that, we give those on Medicaid the option of purchasing private health insurance, which is more frequently accepted by quality doctors. Mr. President, I want to emphasize that our proposal trusts the American people to make the best choices for themselves. That's why we include an expansion of health savings accounts, so people can plan and save for their future medical needs. That also means injecting transparency into health care costs, so people know which provider charges what and how successful those providers are. We include other cost-containing measures like medical malpractice liability reform to help reduce the costly practice of defensive medicine. Mr. President, in my early life, I actually tried medical liability cases, defending doctors, hospitals, nurses, healthcare practitioners, etc. Most of those cases were frivolous. They were brought to get the defense costs. And doctors were scared, so doctors were told, fill up your records to show that you went way beyond the standard of care and the standard of practice. And thus we have hundreds of millions of dollars in unnecessary defensive medicine ever since. We also reduced the distortions in the tax code that actually increase the cost of health care in our country by capping the employee exclusion. This is a key way of restraining costs that has been cited across the economic spectrum. Now, the bottom line, Mr. President, is that this proposal is sustainable and achievable. And without the tax hikes, mandates, budget-busting spending that have made Obamacare so unpopular with the American people. Most importantly, unlike Obamacare, our plan will reduce health care costs for American individuals, families, and businesses. I look forward to working with my colleagues and experts throughout the healthcare community to better refine and improve our blueprint. And that's what it is right now. It's a blueprint. I'm confident we'll be able to build strong consensus around our ideas and be in a position to formally introduce legislation that will repeal the President's health law and replace it with strong reforms that will actually lower costs, reduce spending, and put high-quality care within the reach of every American. Frankly, this approach should appeal to everyone, Democrats and Republicans. I know my colleagues on the other side are very nervous about the failures already of Obamacare, and it's just starting. Anybody who thinks that the rollout disaster can be, once we heal that, it's going to be, everything's going to be okay. Let me just say, that's only the beginning. Obamacare is a disaster, and every day that it continues is going to be more of a disaster. And I think my colleagues on the other side really ought to look at what we're proposing here because it may be one way of helping their colleagues and their constituents understand that they really are serious about trying to get real health care that we can live with and that we can help our country with. Mr. President, I suggest the absence of a quorum.